Any organization, in order to be successful, needs champions. Each of them has served as a champion of the clinic, champion of the cause. And that has helped us in volunteer recruitment and volunteer retention, and in providing quality care to the people that we serve. There's a vision statement that we have at the clinic. We welcome those who need to come without fear. We invite those who serve to come without pride, so that the meeting will bring healing and hope to both. They have, each of them, contributed to bringing that vision into a reality. Dr. Sherman France, you could think of him as the instigator of our clinic. He was the one who went to Hilton Head. He was the one that heard about volunteers in medicine in Hilton Head. When the clinic opened its doors, he was our first president. He has been on clinic staff for 15 years. He's been on the clinic board of directors for 15 years. He still is on the professional practice committee, and he volunteers typically 2 times a month as our psychiatrist at the clinic. One extraordinarily committed individual.
Sometimes when I go to the clinic, I'll feel pretty tired to start with. At the end, I always feel more energized than when I started. And I think it's that interchange of I try to give you something and you give me something. And that's part of the respect. And I think that creates dignity in the patient too, knowing it's an interchange. It's an interaction between us. And the welcoming part has to do with the way we greet people as they arrive, and help them with any questions they have. There's a lot of things in the interactions that occur between staff, patient, and volunteer and patient, which conveys those values.
Wanda Hadley has served multiple roles at the clinic. She has been with the clinic for 15 years as a staff member. She is the lone person who's been with us for 15 years. Wanda Hadley, in the first 10 years, was that key support person who was a clinic coordinator and supported the physicians as they saw patients and provided the necessary support between herself and the volunteers so that they could be effective in their role as a volunteer at the clinic. Over the last 5 years, she stepped into the role of clinical director. She's played that important role of making decisions on medical care when the volunteer physician has come and gone and the medical reports come in about, and making decisions about what needs to happen next. And she has stepped in and filled the voids in our schedule when we have a need to see patients and there was not a volunteer that happened to volunteer for a particular shift. She's been, in her words, it's a mission, her work there.
Every patient deserves dignity and respect, and that's one of the, or two of the things that volunteers in medicine wants always to be first felt. Everyone that comes is welcomed, and no matter what their situation is, they deserve good health care, and we daily strive to attain that goal for them. 15 years at Volunteers in Medicine has been the best part of my nursing career. It is a more than a job to me. It is a mission to serve people, and the good Lord has been so good to me, and He has guided me to be there, and that's why I go back.
Dr. Charles Rao is the epitome of an extraordinary volunteer physician at our clinic. When the clinic opened, he was the person who stepped forward and agreed to be our medical director. He has been our volunteer medical director now for over 15 years. He has served on our Volunteers in Medicine Board of Directors for more than 15 years, which includes the executive committee. He has personally volunteered at the clinic each and every month for the past 15 years, sometimes more than one time a month, sometimes always at least once. And He is the individual who's behind our medical assistance program as the provider. So last year we got $2.7 million in prescription medications. Each and every one of those medications that we received, it was a result of his personal review and authorization of those medications for those patients.
From the very beginning, the watchword for everybody participating in Volunteers in Medicine was the adage, do the right thing. And this just seemed to be the right thing, because there were a lot of people not getting proper medical care at all because they didn't have the money. And they didn't have insurance. And that's why we developed it, to take care of people who had no insurance and were of a certain level of income.
Lisa Maple-McCone was the founding director of Volunteers in Medicine. She was the glue that held the organization together for the first 15 years. It was her leadership that brought many people into our clinic. It was her leadership that brought a lot of financial support to our clinic. She's an extraordinarily talented, skilled clinician. She has great people skills. She has great leadership skills. And her dedication and commitment was absolutely extraordinary. I can also assure you that she had a personal touch that she extended out to each and every patient. Each and every patient felt the care, the concern, and the support emanating from the clinic. The vision came to life through Lisa and through people around her, but it was Lisa's leadership that really helped to bring to light that vision that we have at the clinic.
And I see the first patient, and then I see the next and the next, and I come away really being glad that I did that I gave that time. I think other volunteers go and feel the same way. There was a sense of team, and there's a sense of team for me now, and appreciation from patients who are thankful that we're providing that service, that they can come and be heard, treated with respect and dignity, and have the clinical care that they need available to them.
It's hard to imagine VIM today without these four people. Every organization to be successful has its heroes. These four have all been heroes of Volunteers in Medicine. If we were to exist without the four of them, there would have been a calling for others to emerge. Just as we look to the future, there'll be a calling for others to emerge. Depending upon who emerges and their level of commitment and their passion, we'll have to see how the clinic may shape in the future. I can assure you that we would not be who we are today without these four champions.
Time flies when you're having fun.